This webinar is about instantly having a functional medicine practice. This is possible because very simple things work, as you'll soon see. As a bit of disclosure, my name is Dr. Paul Varnes, and I work with Zorex International, and I do so for several reasons. One is they make it possible for me to give all this material to you for free. You can order from them at ZorexInternational.com. They're an independent company, and those are becoming scarce. I know a couple of companies that I used to use now belong to Nestle and other large corporations. The other thing I like about Zorex is they're never on Amazon. Every other company that I've ever dealt with, you can buy their stuff on Amazon, and I just think that's wrong. They should take the effort that Zorex does. Code PV10 gets you free shipping on your first order. And because of Zorex's efforts, newsletters, patient education materials, webinars at drvarnes.com are available to you free of charge. Why learn functional medicine? The obvious financial reasons, personal financial reasons, it's like getting a 40% pay raise. But we need more doctors to be using functional medicine because the pharmaceutical industry has ruined healthcare. Our healthcare system is broken. We're spending close to twice as much as they do in Europe. Percent of GDP, that we're at $3 trillion a year, costs $11,000 for every man, woman, and child in the country to have health care. And that's because we're more interested in patents than we are in health care. If you look at the current COVID crisis, there's so many natural things that can be done with people that have viruses, but they're largely ignored by our system. And as a result, people are dying. And the reason you can have a functional medicine practice with very little effort is 10% of the knowledge that anyone has in this field fixes 90% of the problems. If you're addressing blood sugar and inflammation, you'll be surprised at how many chronically ill people get better. One of the reasons you can do a very basic approach is that this doesn't work the same way as medicine. It's not like you have to come up with a cure or a specific treatment. Anything you do will help the patient, and you can always change and adjust what you're doing. If you do some basic health things for the patient, you can always change it if they still need to get a better result. And this is where protocol manuals come in handy. Balancing the Body Chemistry has a good one. If you email Harry at bbcnutrition.com or call him at 616-450-5932. He also has a very good manual on interpreting blood chemistries from a natural point of view. You can start doing labs, and most lab and vitamin companies have consultants. You can get help. The idea is just start, and then you can improve from there. And the most basic thing is just address diet. The Western diet makes people sick. It gives insulin insensitivity a foothold. People have blood sugar issues, and our diet is very inflammatory, and all disease is inflammation. So if you can reduce inflammation with the diet, you've gone a long way in helping most people. Also, I've created a program called symptomquiz.com, which will help you develop basic supplement strategies, and we'll get into that in the next webinar. There are a lot of references, scientific references, that support what I'm going to tell you here. In order to keep this short, I'm not dwelling on those because you spend a lot of time, citing who agrees with you. But I do have this stuff in print. We have the type 1 diabetes patient handout, which covers insulin insensitivity as well as type 1 diabetes. It has all the literature references. And then I have a couple of PDFs on this program that has the references for you, and these are free PDFs. You can email me at paulgvarnes@gmail.com. I'm happy to give them to you. And I think the important thing is that we understand and also explain to our patients is we're not treating disease, we're fixing infrastructure. I'll give you an example. There's a lot of research that shows that magnesium helps asthmatics. It actually relaxes the bronchioles. You can give an asthmatic IV magnesium and stop an asthma attack. It's one of the more important nutrients for that. But you have to understand, magnesium doesn't treat asthma. Magnesium treats a magnesium deficiency. Similarly, if there's an iodine deficiency, if they need more antioxidants, all these things will help your asthmatic patient. The other thing to know is that not all cases of asthma are the same. One will have digestive problems, another one will be nutrient deficient, another one will be eating an inflammatory diet. And you have to find the things that lead to that. Asthma is basically about bronchoconstriction and inflammation, and however you address those, and it'll be different from patient to patient. And you should explain that to your patients. And you're never wrong. Vince Lombardi said the Packers never lost a game. We just ran out of time. The natural healthy care equivalent of that is you never fail to help the patient. You just didn't hit the problem hard enough. So should you give antioxidants and magnesium to an asthmatic and they only improve a little bit or there's more to do, you might find they need iodine. You might find they need help with digestion. Goodhart had a metaphor of peeling the onion, and that's what you're doing. And also, when you explain this to the patient, say we're going to start addressing the issues that lead to asthma, not treating your asthma. This is a model created by Emanuel Sherezk, and that explains health and how disease happens. He says that if you have all the core components of health, you're physically fit, you've got good nutrition, you've got good biorhythmic integrity, getting enough sleep, your mental health is good, then you have good enzyme function, good hormonal function, good general biochemistry, good physiologic performance, and no signs and no symptoms. But if you have, say, a bad diet, anything interferes with those core components, you're not getting enough sleep, you're stressed out, whatever it is, then the center of the circle becomes flawed. There are issues in there. If that situation continues, eventually it starts to affect enzyme systems. For instance, if you're eating a crummy diet, you're not getting enough B6, magnesium. These are cofactors that make our enzymes work. And so chemically, your enzymes are not working as well as they could. If the situation continues, then the hormonal system will be affected. Let's say you're eating a lot of sugar. Eventually, you'll start to affect insulin and you'll start to affect adrenal hormone, among other things. Some even say thyroid hormone. If the situation continues, general biochemistry goes wrong. And if it continues, then physiologic performance goes on. Now understand, everything till now, patient might not even know anything's wrong. I mean, you may have ways of knowing, muscle testing, reading a lab between the lines, that sort of thing. But when the physiologic performance is affected, usually this is the patient that goes from doctor to doctor. Something's not right. I don't feel like I used to. Doctors will run tests. They'll say nothing's wrong with you. You probably see these people in your office. This is the beginning of someone seeking help, usually. And if the situation continues, the patient will begin to have signs, which are lab tests that are gone out of line, and symptoms. Now, medicine will address things on the outer part of the circle. They're only concerned about symptoms. You have migraine headaches, we're going to give you some kind of painkiller. You have GERD, we're going to give you an antacid. They're working in that area. Unfortunately, what they're doing too is they're ruining the center even more because all drugs have side effects. Now, what we're doing is we're working in here trying to give the body what it needs so it can heal itself. And the idea is if we fix enough of this, then this big black blob shrinks and the symptoms go away, signs start to improve, things like that. So we're not directly treating the disease, we're basically just giving the body what it needs to heal itself. Perhaps the first person to notice how bad the Western diet is was Weston Price. In the 1930s, he compared ethnic groups that one part of the group would be isolated from civilization, eating the traditional diet. The other group would be exposed to civilization, eating the Western diet. And he found that the group that was isolated from civilization did not have all the health problems we did. They had less cancer, less heart disease, sinusitis, allergies, diabetes, acne, GERD, all the things that we take for granted. he found that these people did not have. And even to the point where if it went on from generation to generation, it changed bone structure, the size of the dental arch. He found that, fourth, fifth, sixth generation junk food started having all kinds of dental problems, crowding, things like that. So with all of your patients, you can do a good job with supplementation. In fact, sometimes it's very surprising how much better people get with just a half-hearted uh, paying attention to diet, and if they're taking the right supplements. But everything works better if you fight inflammation with the diet. You get them off of the obvious junk: sugar, GMOs, refined foods, chemical additives. Basically, if it comes in a bottle, box, or a can, or wasn't available 10,000 years ago, it's not good for you. That simple piece of advice will take care of very many health problems in your office. The other component of this diet, we're going to add something called the specific carbohydrate, which is identical to the paleo diet. You may have heard of the paleo diet. A lot of people think it just has to do with carbs, but it really has to do with complex carbs. This is a diet developed by Dr. Sidney Haas to fight Crohn's disease and colitis. And what a lot of practitioners have found is it fixes most digestive problems. And the reason is we eat too many complex carbohydrates. It's not that they're intrinsically bad, but even things like dairy, which has lactose, which is a disaccharide that has to be broken down by enzymes. Refined sugar, table sugar is also a disaccharide, has to be broken down by enzymes. These are not allowed. And then all starches, starchy beans, rice, corn, wheat. So there's no wheat, dairy, or any kind of starch in the diet. And the reason this was characterized by Elaine Gottschall in her book Ending the Vicious Cycle, you don't completely digest these foods, so they go into the digestive tract and they literally rot. They cause the wrong kind of flora to grow, which irritates the lining of the small intestine, which means even less enzymes, and it turns into a vicious cycle. The worse your digestion gets, the worse your digestion gets. You start growing a lot of wrong flora, and eventually it develops into colitis, Crohn's disease. You might even see irritable bowel syndrome. But we've also found that this deals with GERD and almost most digestive problems people have. And by simply avoiding these foods, and Elaine Gottschall pointed out, about a third of all Crohn's disease, this is enough. And she also points out that after a couple, 3 years on the diet, a Crohn's patient can actually go back to eating normally. Now, if your patients are less ill than this, you do this for a short period of time, and we have a booklet that'll show you how to reintroduce some of the foods. The other component of the diet, and this started when I started reading about the alkaline ash diet, and there's a number of practitioners that swear that alkaline foods, if you eat enough of them, they'll clear up any health problem. The problem is alkalizing, your pH does not change. Your diet, if your pH changes very much, it's usually life-threatening. So diet doesn't really change your pH. But what is true is that eating a lot of alkaline foods, and alkaline foods are fruits, vegetables, nuts, and seeds, and depending on whose list you're looking at, there's different grains that are alkaline versus acid, but mainly fresh produce is alkaline. And I found that these alkaline foods have fiber, carotenoids, and polyphenols. These are powerful antioxidants, carotenoids and polyphenols are, and fiber helps feed the good bacteria. So when you eat a lot of fresh produce, you're actually fixing your digestive tract. You're providing your body with antioxidants. You're giving raw materials to heal. There's a lot of good things that are happening, and this may actually be what the benefit of so-called alkaline eating is, and it's very powerful. So you ask your patients for 30 days because you can do anything for 30 days. And what that does, you don't want to necessarily be a food Nazi, but in 30 days they will understand the connection between their diet and how they feel. And you want them to avoid all the obvious junk. You want them to eat slowly. We didn't talk about that earlier, but chewing your food improves your digestion. You want to eat paleo, okay, no starches, no disaccharides. And then 75% by volume, fresh fruits and vegetables. That's the quote unquote alkaline part of this diet. And this triggers healing. You want them to avoid GMOs because that messes up the microbiome. You want them to eat organic whenever possible. The average American gets about 10 pounds of additives and chemicals in their diet. And then you want them to drink enough water. This fixes a lot of problems, everything from allergies to migraine headaches to, I had one kid used to get two ear infections a year. Put him on the diet. He stopped having his ear infections. I had a friend that chronic sinusitis. Sinuses were always full, always bothering him. Within a week, his sinuses cleared up and he stopped having his 2 infections a year. A lot of things get better with this. Asthmatics will improve. Migraine headaches will improve. A lot of things will get better just following these simple rules. And to make this easy, I created this roadmap to health, which basically outlines the diet for the patient, tells them how to wean themselves from the paleo portion of the diet. It also has recipes and menu suggestions. And this will go a long way. If you email me, I'm happy to send you a copy of this. I will even customize it for your office. I'll put your practice information on it. If you order from Zorex, they will send you a little booklet, a print copy of it with each order, and you can use that as a handout as well. And of course, everyone's worried about compliance. I've told people to do this for, I had one lady with PMS, said, go ahead, just put her on the diet. And he was a chiropractor, could start adjusting. Usually that'll clear up the PMS. The problem is, and maybe this is true for most of you, you're afraid to tell the patients to do this. You're worried about them being non-compliant because the junk food is addicting. Michael Moss wrote that the processed food companies have made this stuff addictive. They actually hire neuroscience scientists to see what combinations of sugar, fat, and salt trigger the pleasure centers of the brain, and they work at it. And you might even notice that people, they're not hungry, but they're eating anyway. It interferes with satiety, and it's very difficult. That's why we want the 30 days to break the pattern. However, some people won't do it. They're addicted. They don't want to do it. And I usually tell people, fine, we'll just, we'll do more visits, we'll sell you more supplements, but understand that the diet is the cornerstone of what we're trying to do. And even those who are not compliant will eventually start improving because they notice if they eat a certain way, they do feel better. I had one fellow with 600 triglycerides and did not want to change his diet, and we gave him a lot. He said, I'll take as many supplements as you want. So we gave him essential fatty acids, we gave him niacin, we gave him lipoic acid, we gave him a blood sugar type multiple, and he took all the pills religiously and kind of sort of watched his diet, and we got his triglycerides down to normal. So the diet makes things easier, but don't give up if they don't follow it or if you don't have compliance. But do explain how important following the diet is. When you learn the piano, you don't start out playing Chopin, and you might notice somebody playing Chopin and it might intimidate you from trying the piano, but someone can teach you to play chopsticks in a few minutes. And dealing with insulin sensitivity is sort of like the chopsticks in natural health care. And as you learn this material, there are really elegant things. There's a lot of chemistry to know and all that, but the purpose of this webinar is that you can get started. You can do a lot of people a lot of good with really simple basic things. And insulin insensitivity, there's 30 million Americans that are type 2 diabetics, and about 25% of them don't even know they have it. Another 84 million have prediabetes or insulin insensitivity, and only about 11% of those people know they have it. So you're talking about over 100 million people. And what you need to understand, there's a lot of problems that are associated with it. People with migraine headaches, people with digestive problems, people with, women with polycystic ovary disease, PMS, all these other problems. If you take care of inflammation and insulin insensitivity, you've gone a long way in clearing out a lot of the chronic health problems within your office. You can say there's over 100 million patients that this is an issue for. Low testosterone is one I didn't mention. And in any kind of inflammatory condition, insulin insensitivity is an inflammatory condition. So a lot of, basically anything chronic that goes wrong, you're going to help them. Even cardiac disease, metabolic syndrome, high cholesterol, high triglycerides, even high blood pressure. A quarter of your high blood pressure patients are that way because they are insulin insensitive. So this is a very important thing to look at. And you can screen for it. If they have an A1C over 6.5, they're type 2 diabetic. If it's between 5.7 and 6.4%, that's pre-diabetes. You can eyeball a person if they're craving sugar and they need to lose a few pounds. If you address insulin and sugar in them, you're going to help them a lot. It depends on what the laws are for blood work, but A1C test is relatively inexpensive, and it gives you an entree into this therapy. And you want to pay attention to glycemic load. Glycemic index is how fast a food will raise your blood sugar. Glycemic load is the real burden. For example, watermelon has a high glycemic index, but not much of a glycemic load. Fruits are like that, whereas other foods will have a high glycemic load. The Roadmap to Health diet is good enough, but sometimes people are intimidated by that. You want them to have a glycemic load that is less than 10, and I have a chart that you can use. Overall, I still recommend the Roadmap to Health diet. Also, insulin sensitivity diabetes. I've seen patients where there was actually a food allergy component. I had one fellow had 400 blood sugar. No one could do anything for it, and we took him off of gluten, and his blood sugar came down. And what's nice about the Roadmap to Health diet is it is hypoallergenic. Perhaps the most important nutrient you can give anybody with insulin insensitivity or type 2 diabetes is magnesium. Magnesium lowers A1C, it improves cholesterol and triglyceride levels. Low magnesium is associated with neuropathy in diabetics, and it helps prevent the transition from insulin insensitivity or prediabetes to diabetes. But the most important thing is, if they are overproducing insulin, it interferes with the absorption and utilization of magnesium. So if they have blood sugar problems, they automatically need magnesium because you're not getting it. Many of the vitamin companies make a multiple that is designed for people with insulin insensitivity. It'll usually be called glucose something. It's got a lot of B vitamins. It'll have magnesium, zinc, chromium, vanadium. Different companies use different formulas. Zorex makes one called CGF, which contains all these nutrients, and it's a multiple vitamin designed to address insulin insensitivity. And it's especially good, if you got someone that's putting on weight and they've been eating a lot of junk, this is a good kind of product to use for them. The other thing that insulin insensitivity can lead to is fatty liver and biliary stasis. You get fatty liver, and then the bile starts to thicken, and this can eventually progress to gallstone cirrhosis. And watching sugar will help improve it, but sometimes you need a little more help than that. Biliary stasis, this is the patient who tells you that greasy foods really upset their stomach. They tend to have dry and itchy skin, clay-colored stools or fat in their stools if it's worse. Reflux, a lot of people that the reflux are taking antacids and things and they're still not getting any better, they might have biliary stasis. They might have bitter metallic taste in their mouth, and also they'll tend to be deficient in vitamins A, E, D, and K, all the oil soluble vitamins. And a lot of times, one thing you can see for sure is that they got dry, cracked heels. or patches of dry skin, they itch. Usually you need some kind of extra support for biliary stasis, and this is common in your insulin insensitive patients. So treatment would involve getting insulin sensitivity under control. If you need even a little more, products with artichoke or beet base. Artichoke tends to be better, that it thins bile, and GB Complete from Zorex is such a product. Some people need bile salts, especially if they've had their gallbladder removed. A patient with no gallbladder should probably be taking bile salts. It protects their gut. It also helps them get these oil-soluble vitamins, because you need a little shot of bile to digest that, and you take bile salts with your meals to get your oil-soluble nutrients. Zorex does not make that, but Biotics makes one called Betacol. Standard Process makes Colacol too. These are products that for bile salts. Also, if your patient has biliary stasis along with their insulin insensitivity, giving them an essential fatty acid product is a good idea. It fights inflammation, it fights heart disease. They'll just do a little bit better with this added to the mix. And people love to give fish oil, and there are studies that show, oh, we brought your blood sugar down with fish oil, we brought your cholesterol and triglycerides down with fish oil. Problem is, all those are short term, and the oceans are full of dioxin, mercury, and plastic, especially plastic. Companies will test for mercury, they can't test it. There's all these lightweight toxic chemicals. I mean, there's an area of plastic in the Pacific Ocean that's the size of Texas, and there's all these companion chemicals that come into it. So fish oil has been touted as a more active omega-3 oil, but you're much better off with a balanced product for long term. Really quickly, flax oil is such a product. Zorex makes flax oil for that. Berberine's another product. If they're actually diabetic, berberine performs similarly to metformin, and it can bring down A1C. So if a patient's actually type 2 diabetic, that's a product that you can give them 500 milligrams about 3 times a day. If you do start treating someone who's, especially if they're on a drug for diabetes, have them monitor their blood sugar, because the natural stuff works and it will bring them down, and you don't want them taking too much of the drug because of your therapy. And lipoic acid is worth mentioning, because diabetics that get neuropathy will often respond to lipoic acid. Dose is 200 milligrams 3 times a day. There's a lot of research to support this. So basic treatment for someone with insulin sensitivity, we're not getting into diabetes, but actually diabetics can respond to this too. You have them stop snacking. When you eat, you produce insulin, and if insulin insensitivity is a problem, you don't want them to wait 2 hours after eating and then start producing insulin again and again and again. If you wait long enough between meals, you start producing glucagon, which actually burns up the calories that you've done. And it's one of the reasons intermittent fasting works so well. Intermittent fasting is you wait 16 hours between dinner and breakfast the next morning. So if you have dinner at 6, you don't eat breakfast till 10 the next morning. And that works really, really well. You have to be careful. If a person has adrenal issues, you don't necessarily want to be doing that. The other thing that you can have them do is daily light exercise, and of course the Roadmap to Health diet. So you make these changes for everybody with insulin sensitivity. The other thing you want to get them is much magnesium orotate or magnesium tauronate to bowel tolerance on an empty stomach. Okay, magnesium binds to fats in the diet, so you take it the very last thing at night on an empty stomach, and it will also soften stools. So you have them take one night, 2 the next night, 3, and so on. Their stools get soft and they back off. So say they take 5 and their stools become soft, and 4 is their nightly dose. And then the CGF, the complete glucose formula, 2-3 times a day, along with the Roadmap to Health diet and the other lifestyle changes. Most people with insulin insensitivity will improve And then also a lot of the other things. So if you've got someone with insulin sensitivity, they got migraine headaches, they got asthma, they got bowel issues, a lot of these things will just clear up. If they have dry, itchy skin, cracked heels, add GB Complete 2-3 times a day, and then Sunflex Complex 2-3 times a day. And if they're type 2 diabetic, and you could possibly add berberine, 500 milligrams 3 times a day, or LPA plus if they've got neuropathy. And I'm trying to think of what roadblocks would give you problems. In other words, if you're doing this, you might be concerned about non-compliant patients, but like I said, just tell them that it's more supplements, more treatment. You get a better result with the diet. Try to, nutritional consultation is a negotiation. And also some of these protocols, especially if you get the one from Harry, is really, really good. You can do a lot with the right kind of supplements. If insulin insensitivity is not the issue, we're going to cover different kinds of things in basic supplementation and talk about symptomquiz.com later. Also, you can get a protocol manual and try, just do the Roadmap to Health diet and try some basic supplementation. Because even if the patient still has problems, you think of it as peeling an onion. They'll get a certain amount of improvement, and then you can add to the treatment or change it. I had one lady, she had really bad reflux and asthma, and the Roadmap to Health diet kept her under control. Everything cleared up her problems. The problem she had was that if she didn't follow the diet, her symptoms would come back. So then you start thinking of, okay, can we give you some hydrochloric acid? Oddly enough, that works for GERD. Can we give you something to heal your digestive lining? Can we add some supplements? Iodine's a real common one. Iodine thins mucus and will help asthmatics. And you can make it so. And George Goodhart said you should be able to go downtown and have a Coney Island hot dog and a beer and not have it bother you. Well, when they're chronically ill, they can't get away with that. And you kind of do want to get them to that place. You have to realize that while you're not just bringing the symptoms under control, you're actually triggering healing within the body. And the best way to do that is to just start doing that. And then look at other materials. I've gone to a lot of seminars and found that, gee, if I didn't know anything, the seminar wouldn't have much for me. But once you get started, then those seminars start making more sense and you start picking up nuance. Like I say, different labs, different vitamin companies will teach you different things. And also they tend to have people on staff that can help you with your problem patients. I love Dr. Brownstein's books. He's got some really, really good ideas, and he's written a number of books, and his stuff works. So think of what you're doing here as just a start, and you're going to do better from here. So this seminar is basically to teach you to play chopsticks, or if you're reading, see Spot Run. We're going to do future webinars and go into more treatment, more specific kinds of things. You can build on this base. And once again, we've got protocol manuals, Dr. Brownstein's books, different labs. Microbiome Labs has protocols and ways of testing what's going on in the gut. You just take what you've gotten here and build from it. And if you're a medical doctor that doesn't do any nutrition, or if you're a chiropractor that has a musculoskeletal practice, the best way to introduce this to your patients is to create a wellness plan. And I have this poster. I can customize it for you, and it tells them to go and take a health quiz. And that's symptomquiz.com. You're welcome to use that. It took all references to me. It's very generic. We're even going to find a way to add it to your website. I talked to my web guy, and he can do that inexpensively. He's going to do it at his cost, basically. And as we do more of them, I think the prices will go down. So if you want to get started with this, feel free to contact me, and I'll help you. The other thing about the Roadmap to Health diet is It's a weight loss plan because it isn't how much you eat that makes you fat. It's what you eat and when you eat that has a lot to do with it. And we have a patient education thing here. Diets make you fat, which they do. And then this also a poster. These can be also customized for your office. And I'll post recordings of these webinars at drvarnes.com. Symptomquiz.com is great to use. I have a manual on how to use that. If you want to get a head start, email me. I'll send that to you. We can customize symptomquiz.com, put it on your website. And the second webinar will get into more detail. Just start doing basics with people and build from there. And once again, if you need any help at all, feel free to email me, contact me. I'm happy to do it. I think it's very important that there be more of us that do this kind of work.